So how worried is the NHS workforce about simply going to work right now? And is the guidance clear over whether mums-to-be should still be working? I'm joined by one of our regular doctors, Dr. Larisa Corda, an obstetrician and gynaecologist at a London hospital. And from the pregnancy campaign group, Pregnant Then Screwed, Jolie Brearley. Thank you both for joining me. Larisa, are you or your colleagues worried about the exposure you are all getting to the virus at this time?
I think the exposure that any of us get in the hospital is, of course, worrying, especially if you're working in critical care areas, which is where I've been deployed to. And I happen to have colleagues who are pregnant and who've decided to put themselves on the line simply because they understand that their skills are so in demand at this moment. I think the question of whether healthcare workers who are pregnant should be in hospital at all is a really, really difficult one and an agonizing decision for any woman to have to make, because of course it comes with it this added level of pressure, understanding that these skills are in such huge demand. At the moment, the Royal College of Obstetricians and Gynaecologists has advised that all women in the third trimester or those with underlying health conditions should not be working in hospital and should ideally be at home in order to try and avoid exposure to coronavirus. And most of the studies and most of the evidence coming out so far is regarding the third trimester and potential complications in that. We don't have enough evidence at the moment about the first and second trimester, and this is where the guidance is a little bit more lenient. So the RCOG has said that if a woman who is 28 weeks pregnant and decides to undertake a patient-facing role, she can do so, providing she takes the necessary precautions with the personal protective equipment and ideally tries to avoid areas where the exposure of coronavirus is significant. Now, as I mentioned, this decision is incredibly difficult for most medics to make because, of course, they're stuck between a rock and a hard place. If they decide not to go on that front line, then the amount of guilt that they feel over it is quite enormous and significant. And I think it's really, really important to stress to employers that whatever decision a woman decides to make in her first and second trimester or even third trimester must be respected and must be supported. And every effort should be given towards protecting that woman, because we just don't know enough yet about the complications to mother and baby from this virus.
Larisa, thank you for that update. Jolie,